So in your opinion, doctor, if there's a family history, one should start at 40 and possibly get that test every year, correct?
Right, more than one relative, first-degree relatives start at the age of 40.
And if there is no family history, then?
At the age of 50.
50. Yeah. And would you say every year or every other year?
Well, I mean, we look at PSA velocity, and I'm not sure that was quite clear in the statement, but as the PSA rises slowly, small increments of PSA are okay, but if the PSA rises more than a certain amount per year, that is a flag. So we look at that. So
and can you explain that PSA for us?
So PSA is basically an antigen, a protein that is measured in the blood. Okay. It's prostate-specific antigen. And it's a simple blood test. You draw blood, you get the results within 24 hours. If the PSA goes up more than, say, 0.75 nanograms, that's the unit, per year, that's a flag that something could be happening. Now, let's make sure that people understand. Other things can rise the PSA, like a prostate infection, inflammation.
Okay.
So that's why we want to monitor these rises and understand what's causing them.
And we have a few tests. The doctor mentioned a blood test, a prostate-specific antigen PSA blood test. There's also a digital rectal exam, which is DRE, if we could talk about that, doctor. And any other tests? So can you go through those?
This is very important because sometimes the PSA does not go up in patients. In some patients, this is rare, but it can happen. The PSA does not necessarily go up much, very little. And some cancers are picked up only by the digital rectal exam.
Wow.
So patients will ask, well, can I do just a blood test? No, because you might be missing 1 in 10 or 1 in 20 patients that have a cancer that the PSA does not rise. So you would pick it up on a digital rectal exam.